some very important concepts. So I set up, you must know 3 things. So before we start our course, I have introduced this concept first. Okay, so the 3 major basic concepts, including these 3 things. The first one is about the orientation. 中文叫方向 okay? The second one is echogenicity, I mean the 回音度. And the other one, you need to how to use and amputate the probe. So it's the amputation and manipulation, the 探头手法. So I will introduce very quickly, let you can have some insight of the ultrasound, okay? So at first, let's introduce the orientation because we need to talk the same language with some sonographer. And when you post an ultrasound picture, you should align the pictures who are performing the exam room. So at first, we have to know the same orientation. So let me introduce the first one. Orientation is sagittal view. It means your probe will align the sagittal view. That will, when you see your screen, like this screen, you can see the sagittal view. On your left side is your head. On your right side, when you see the screen, your right side is patient's foot or patient's feet, and the anterior and the posterior. When you rotate, I mean rotation the probe or rotate the probe, it will become the transverse plane. I mean the transverse view. It will show the right when you see the screen, on your left side is patient's right side, the patient's right side, and on your right hand is patient's left side. Okay, just like the CT scan. So please, you can try to connect the image with the correct orientation. So let me show you the pictures. So you can see we have the probe marker and the screen marker. You just make them the same in the same direction. If your probe marker put toward the head, your screen marker, it should be means on the screen. On the screen, your left hand is the patient's head. So it will be the same way. The orientation is correct. Okay, and follow this rule. So you can see, I mean the transverse view, it means the transverse planes. It should be like this. So you can see when you see the screen, you see the ultrasound pictures. When you see the screen, your left side is patient's right structure, and the left side, your right hand is the left side of the patient. So you just think about that is like the CT scan. When you read the CT scan image, it's almost the same. So if you can perform the ultrasound well, it means you like the CT scan. Okay, let's move on to next. And the first one, the orientation, is very important. The second important thing is the echogenicity. Actually, the ultrasound is a grayscale image, so you need to know what is the dark, what is the brightness. So you can see these pictures. This picture is for the heart. So you can see the chamber, the left ventricular, and the right ventricle, and you can see the valve. So what is the echogenicity? It's very simple. Just think first, very dark and very brightness. So when you see the image very dark, even the black, you can call it anechoic. And it's very brightness, you can call it hyperechoic. So what's the materials? What are the materials with this echogenicity? Let me show you. Very simple. So you can see a scale like this. The air and the bone is very bright, and the water and the blood is very dark. So I can give you very simple summary. The water and the blood, when you see them in the ultrasound, the pictures, you will find it's very black. We call it anechoic. So when you see the anechoic lesion, it could be contains the water blood. And on the other hand, if you see the hyperechoic is very bright, it means it will be could be the calcification or air. But you know the calcification and air is dramatically different. So you need to think about uh, how do we identify it. It's very simple. Just follow my slide. The artifacts is the key. So if you take notes, I will tell you when you see the hyperechoic surface, you presume it is calcification. It will combine with the acoustic shadowing. It means a clear shadow, totally dark, the shadowing. But if you see this hyperechoic surface, you suspect it is air, so it should be combined with the dirty shadow. It's not very clear shadowing like this. So it's a difference. So if in the future I have the chance, I will talk about the some very basic image concept. I will introduce the artifact. I will spend some time on explaining the artifacts. Okay. Okay. Uh, Another thing I need to mention is that the echogenesis is not totally the very dark and very bright. I mean the anechoic and the hyperechoic. Sometimes when you describe some lesions, you can use comparison. I mean, when you just like this photo, you can see I I can try to describe this lesion in the liver. I will uh, describe like this way. I see a round lesion, hyperechoic round lesion, about maybe 2 centimeter in liver parenchyma. It means the baseline is the liver parenchyma. This lesion is hyperechoic than more hyperechoic than the liver parenchyma. So in the same way, you can describe a lesion is hypoechoic, even the isoechoic and the anechoic. I need to mention the anechoic with some special artifacts like this. They will, you can see on the edge, you can see the dark line in here is, we call it the edge shadow. And combining the acoustic enhancement. So it's the artifact that you can identify the difference between the hypoechoic and anechoic. Okay, okay. Let's move on. The another important thing is manipulation. So we have five manipulation because in the future I hope you can practice it in your clinical environment. So I need to teach you how to use it, not only read. So you can see the sliding, rocking, tilting, and rotating and compression. Five major manipulations. So let me demonstrate for you. So if you, if possible, maybe Jessica, you can turn the channel to my the things. I can demonstrate how to use it. Okay, so I hope Jessica can hear us. Okay, so when you hold your probe, so sliding is means you need to move, you need to move your your probe along the x axis or y axis. You can slide. So rocking is like just like a rocker. So you will like this. Lesion is over here. You just left and right rocking. And the other side, the other thing is tilting. It means when you put the lesion, you just along the short edges and try to tilt. And the rotating is very simple. Just follow your central point and try to rotation it. Don't you do like this. Like this, it means you do the two manipulation, sliding and the rotation. So it's very important. The final thing is compression. It means we need to make sure the under the ultrasound maybe some lesion it could be the the vessel, and it could be the vein low pressure. So when you give them some pressure, the vein will collapse. It will help us to identify the structures easily. Okay, so let's find major skill. So Jessica, let's turn back to the our slide. Okay, so if you understand how to do that, I know you will have some chance to do it by your own, especially you don't have much or you don't have many experience, but you need to do, then you know what do you need. So at the first, I always teach my medical student, you need to look very professional. The only two button you have to know on your controller is only these two things. You need to learn how to adjust the depth and the gain. So this is will make you more professional, because when you know how to do this, your patient will cooperate with you. If you cannot do this, you just look like a rookie. He will think, oh, why do not the experienced physician to do ultrasound for me? It's a rookie. So you need to make you like a professional person. So when you can use these two buttons, you make you very. It's very useful, and you will make you looks professional. So you just turn on the depth and turn back. Oh, so when you do something on your controller, it will make you looks better. Okay, and you will start have your confidence. Okay, so but these two buttons is also very important and very basic. So the depth is means you will adjust the depth. So you can see I increasing the depth from the left side to the right panels. And the brightness it means gain. Sometimes you see the uh, the 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 picture is so dark, so you can try to enhance the image. So you can turn on and you can rotate the game, adjust the game. It will make your image more bright. So it means from the left side it's very dark, and increasing the gain from left to right panels. Okay, that is the three very basic but very major important ultrasound concepts you must know. So let's get some review. Then uh, we start to learn today our topic. I think everybody can relax because next time I will tell this again, this basic again. But because he had a past history, the hypertension, smoking, he complained of the abdominal pain, dizziness, and that is his vital sign. I think before you perform the ultrasound, you need to think about what's going on. So, what is your next step? What kind of the image fidelity you modality you will use, or what kind of the image you want to arrange? And the most important, what is your differential diagnosis? So I think most of you, maybe you can key in the chat room, but I think it's important because if you want to make your focus more efficient or more effective, you have your own uh, differential diagnosis. So what is your differential diagnosis? Maybe in your brain, you will think about it's just the AGE gastroenteritis, or maybe you will think about aortic dissection, abdominal aorta aneurysm, etc. But whatever, when you think about this, the most critical is could be the vessels problem. So let's look at the image. So when you just put on your probe, put your probe on the patient's abdomen, you can see this image. What is the pathology? So it's very simple. It's just the abdominal aneurysm and the rupture. And I start to measure the diameters. But this patient is lucky because only in the very early stage just rupture and within the intramural. So we saved this patient. So that's I what I mean. The poke is important because it will make you can realize and recognize your thinking immediately. So it's quite important. So today our vessels introduction, I will introduce two major vessels. I think it's important. So this is all based on the American College of Emergency Physicians, the policy of statement of the point of care. So uh, actually, we will learn many functional clinical categories for the resuscitative, diagnostic, or symptom or sign-based is essential. But today, I will focus on two major vessel systems. It's the abdominal aorta. So we need to learn the sonal anatomy of aorta. And we will learn the DVT, deep vein thrombosis. So we need to learn how to screen the big vessel, big vein. For example, the IVC, inferior vena cava, and the femoral vein, femoral artery, and the popliteal vein and the popliteal nerve, artery. Okay, okay. So let's move on to this. So if we want to use the vascular system in the POCUS, so we need to know the vascular system is very dangerous and very emergent. So my scanning strategy will from the central to peripheral. And I will think my differential diagnosis, I will think the crucial diagnosis first to urgency or urgent. Then I need to make sure ultrasound cannot solve any diagnosis, cannot solve or cannot screen every anatomic structure, but we need to have know the ultrasound's function. It will help us to apply it appropriately. Okay, so let's review the aorta anatomy. So you see, this is the total aorta. So I try to separate. I separate to three zones. The first zone is the aorta, aorta arch, and the thoracic aorta. Okay, and you need to note the ascending aorta. I will mention it, and I will introduce it in the hard topic because it's almost together. Okay, but you need to think about, can I screen or can I screen the aorta arch or the thoracic aorta? Actually, a little bit difficult. But if you have the appropriate probe, we can do it. But most of us can do this. You can screen your aorta in the zone 3. I mean the zone 3, the lower, the bifurcation of aorta and the common iliac artery. And of course, our major target is scan the abdominal aorta IVC and the ciliary trunk and the SMA. But you can circle the IMA, but why should I circle it? Because it is difficult to scan it because it's very small than the SMA. But sometimes you can see it. So I think that is the major aorta anatomy. So some of them we can scan it very easily, but some of them is a little bit challenging. Okay, so let's focus more on the abdominal aorta because it's more easier for us because we can use the abdominal probe or curved probe to explore the problem of the aorta, and it's very important and crucial disease including it. Okay, so let's review the abdominal aorta of IVC. It's very simple because it's just located in the midline of our body, and the aorta it will be the left to the IVC. It's very close. Please take note because it's very close. So don't use the too much sliding to scan it. You can just find the one and try to find the other one. For example, when you see this artery is very close, when you do some screening, when you see the aorta, you just do the manipulation. What kind of manipulation you can ask? This is, or we only use the tilting. It will help you to find the IVC. So don't do too much sliding, because when you sliding more, you will miss your orientation and you will miss your target. Okay, so it's very, very, very important skill and very crucial skills. Okay, so let's check. So if we see the aorta, we just follow the main trunk, and you will first division is a ciliary trunk, and the ciliary trunk go to the right side. The patient's right side is hepatic aorta, and go to the left side is the splenic artery. Okay, and you can move your probe downward a little bit, and you will find the SMA immediately. Okay, then you have to move your probe to the end of the aorta, and it will become the two common iliac artery. So I try to make you can remember it very easily. Okay, okay. So that's very important, is the main trunk. So let's see the image. So when you put the probe on the epigastric area and try to slide downward, and you will see the aorta in front of the spine, and his neighborhood is IVC. And when you see the first division is the ciliary trunk, and go to the right side is hepatic artery, left side is the splenic artery. So just like this. So please put your probe on the epigastric area and try to slide down. Okay, and slowly you can find the first division. Okay, if you can see the hepatic artery, ciliary trunk, and the splenic artery together, we call it the Sigur sign, the Sigur. Okay, and if you slide after you explore this structure, then you can try move your probe lower. You just a little bit lower, you will find an interesting structure. You can find the aorta, and you will find, oh, it's a round, means a circle area is the, that is the tubular structure is the SMA, superior mesenteric artery, and above it you can see the splenic vein, and above the splenic vein you can find your pancreas, not yours, your patient's pancreas. So it will maybe help you more. So from this is almost, I mean, the landmark. So here you see the aorta, and here you see the small tubular structure SMA, and then you can see above it is the splenic vein. Above the splenic vein, this soft tissue structure is pancreas. So it's very easily, you can very uh, easy to find it systemically, not very random or incidental find this structure, the other structure. I will teach you how to perform it more systemic searching. Okay. Okay, so you can see that is the structure. So sometimes for some thin body, you can see the renal vein. Okay, so it's another important thing, and you can see the IVC over here, just next to the aorta. Okay, so let's transfer to, and let's turn to the longitudinal view. It means the sagittal view of aorta. So how to do that? Rotate clockwise very smoothly 90-degree. You can find the longitudinal view of aorta. So you can see the aorta, and you can see the first division is the ciliary trunk, and very close you can see the uh, SMA. Okay, and they just tilting to patient's right side, you can find the IVC into the right atrium. That is very important, because we will measure the IVC diameter to estimate our body Marlin status. Okay, so later I will tell you. Okay, so it's important. So that is very quite easy to search these structures. So what I mean the IVC important because it almost reflects our violent status in some conditions. So it's some reference to help you to decide, give them water or give the patient the iatrogenic medicine. So it's very important. Okay. So let's talk about the IVC. It's a quite important great vessels. So you need to perform a skill, the inspiration and the expiration during your scanning. So you can see when you find the correct uh, location, you can see the totally can see the IVC, and you can observe the hepatic vein below the hepatic vein, or please take note below the hepatic vein, maybe uh, 0.5 centimeter or 1 centimeter, or things from the RA and the IVC junction 2 centimeter, 2 centimeter to 3 centimeter is the best place to measure the diameter. You can put here, and you can put your probe here, and you can observe this place. This you can observe this place and measure the IVC diameter. When inspiration, you will collapse, and the expiration, you will distend it. You will measure the collapsibility. So you will like this common. So you can see for the clinician, we just want to know how to measure it very quickly, and it also means some clinical meaning. Okay, so if you see the diameter is less than the 2.1 centimeter, and when inspiration you find 50% collapse, over 50% collapse, it means the CVP level is lower. You can give the patient more fluid. On the other side, or on the contrast, if you see the diameter is over 2.1 centimeter, and inspiration, the collapsibility is less than 50%, it means the CVD level is higher. Maybe you need to consider to give this patient some uh, inotropic agents or inotropic medication. Okay, so it's some guide or some reference to help you decision what is your next step for the shock patient. Okay. Okay, final thing I need to talk about another spatial view is corner view. Sometimes if the patient with much gas in abdomen, or please try a corner view. So from corner view, you will see the liver first, then you will see the IVC, and next to the IVC is the aorta. If you see this picture detailed, you can see these are two small branch, that is the renal veins, renal arteries. Okay, so it's very clear. Okay. Okay, I think because of time limit, so I will show you very quickly for live demo, but please allow me to do this. Okay, so let's go to here. So when we start to scan the aorta, you can put the probe like this from the upside to the downside. So you can see very clear the liver, and you see the distended IVC, and but this is a muscle man, so everything is clear. But our patient not. So sometimes you need to correct it by yourself. Sometimes some patient is very fat, difficult to scan. Okay, so you can see the IVC. So I see this is the aorta, and I try to find the first branch is the CDA trunk, and here is become the SMA, the small tubular structure in front of the aorta. Okay, here, and I try to search the aorta to the bifurcation. Okay, you can see the bifurcation again, bifurcation. It's very important because most of our abdominal aorta aneurysm is between the infrarenal area. So you have to search the aorta until abdominal aorta aneurysm until to the bifurcation. It's more safe. Okay. And let's try to turn back and rotate our probe like this way, and you can see very clear aorta. And if you move your probe over here and use a rocking scale, you will make your vessels more strength. Okay, so you can move up to the epigauge area. You can see that this is the SMA, and the small one is the first branch is the ciliary trunk. It's very clear in this place. And try to observe my skill. At this time, I will tilting my probe to the patient's right side. So you can see when I move up and tilting, and I try to tilting to try to find the tilting and find the IVC. It's the best way to search the aorta and IVC at the same time. So I think you can understand what I mean and what I perform the skill. Okay, okay. So the time is stressful. So if I try to finish it within the 14 minutes, but I think if we over this time, it's fine. Left lower leg edema, and but this patient with the colon cancer, that is her vital sign. So you can see this. These pictures shows her legs. Okay, so what do you think? What is your next step? What is your differential? What problem you need to solve if this patient go up to the general ward? You will become the critical or not. Okay, so I think most of you maybe know or maybe recognize it could be the possibility of the DVT based on the well score, and we also have the DVT clinical algorithm. So let's turn back to the algorithm. I make it bigger. You can see if we suspect a patient with the DVT, we can do some pre-test possibility for this. You can use any scoring system. If lower, you can check the D-dimer. But after D-dimer, if you think it's positive, you need to make sure the DVT. But if you highly suspect this patient will have the DVT problem, you will do the ultrasound. So actually, if you can understand how to perform the ultrasound, you almost you don't need the DVT. You don't need the D-dimer to prolong your diagnosis process, because if you have the ultrasound ability to scan it, it's over. You can do very quick and effective scanning. So let's talk about the DVT mechanism. So this big thrombus will impact in some part of the vein system, great vein system. And between it, if you see impact in here, so when you put the probe over the upper wall, for example, you put your probe on the femoral vein, it will easy to place, to totally compressed, because you don't have any obstruction up than that. But if you put your probe on the popliteal vein, it will be difficult to compress because it will be some pressure. Okay, so that is the basic concept. We apply this concept to ultrasound. So you can see we need to put the correct and appropriate posture like this, just like the frog leg. Okay, and you need to put your location. So location only 2 point check. Take a note, 2 point check. The first place you need to put your probe on the femoral artery or femoral vein, and the other place the popliteal artery and the popliteal vein on the popliteal area. So this is a 2 point scanning. It will help us to identify or differentiate the DVT problem. Okay, so these 2 points. And this point is femoral artery, femoral vein, and this is popliteal and a popliteal vein. So what, and we also need to use the one manipulation, the technique is compression. So if the vein is compressible, it means the flow is smooth. If this vein is non-compressible, difficult to compressible, it means maybe partial or totally obstruction above that. So compression skill is quite important. So let's look at the normal image. So you you have to try find the femoral artery and the femoral vein and give them use your probe, give them some pressure. So it will make the vein compressed. So you can see compressed, your vein is dismissed. And when you release the pressure, the vein appears. So it's very important skill to identify the vein flow. Okay. Okay. Let me give you some live demo. It's like this: compressible and something will compressed, totally compressed. So that is vein. So I also add some Doppler to make sure the flow velocity, and you can see that's very simple. Just apply the compression skill. Okay, so very quick because our major part is anatomy. So you need to imagine that. So the water, the what kind of the echogenicity of the water, what kind of the echogenicity of stone. So you need to transfer your anatomy knowledge to sono anatomy. Then next time 2 weeks later. So right now we have the 2 weeks later course. 2 weeks later, we will learn the pathology. So the hands-on by your own and try to review and just hold your probe and apply it in your patient. It's no harm, no pain, just try. So please, before next time, I hope everyone online. Actually, I don't know how many people online. I just talk the slide very quickly because I have the truth, the ciliary trunk SMA bifurcation, and you try to find the inferior vena cava, try to measure the diameter, and you can find the two major big vein. I mean the femoral vein and the popliteal vein. It's compressible or not compressible. So you can try if you have any skill problem, you have any ultrasound problem, please just uh, follow our course, and you can post your question on the course in here. So